So before I get into the phases of the project, we have a couple of polls that we'd actually like to engage you in, just to get a sense of your perspective. So I'm going to ask Danielle McDonald, and I want to acknowledge her and thank her for her help today as our research assistant. So the first poll is from those of you who are today. Have you been able to integrate equity considerations into your COVID-19 planning and response? And while that poll is going on, I just want to give a summary of what you said you wanted to learn as you registered for this webinar. And there were 4 main themes, and we really think we can hit on all of them. First is emergency preparedness planning and connection to health equity. You wanted to learn about indicators that are relevant to health equity. You wanted some support in your advocacy efforts for a stronger focus or for a focus on health equity. And you definitely wanted to hear about the evidence and the tools to support equity-informed emergency planning, response, and recovery. So that was a theme from what you said in your registration. Okay, I'm really heartened by this result here, that 81% of you said yes, that you've actually been able to integrate equity considerations into your COVID-19 planning and response plans. So next poll, please, Danielle. So this is just to give us an idea from your perspective as you're thinking about this, what would actually support, if you wanted to enhance that, so you're saying yes, you were able to, most of you, but what would enhance the integration of equity into that emergency planning response and recovery? So these are just some ideas, and you can check all that relate. So is it an evidence review? Is it a set of indicators? Is it measurement tools, policy changes, whether those are organizational or system-wide policy changes? Is it quality management and evaluation? Is it a dashboard? We sort of had thought about a dashboard. We'll speak to that later. Margaret will. And if there's others, just please tell us about those in the chat box. Okay, so really interesting results here. So a number of interventions, if you will, or a number of tools would be helpful to you, but the one that's really leading the way here is that set of indicators. So, that's what we're going to talk to you about today. So thanks, Danielle, for that and for the polling, and thanks everybody for responding. So just really quickly, in terms of the project phases, and this is our collaborative project, we're calling it, so between the National Collaborating Center for Infectious Diseases and the National Collaborating Center for Determinants of Health. And I'm going to give Margaret full marks for sort of really having this vision that we could do this together, that we could look at emergency preparedness planning, and in this pandemic. This was early days back in the spring. And what we conceived was a project that would have some phases to it. So the first one was to really take a look at those key documents, key reports that evaluated previous public health preparedness and response, and see what we could find in terms of how it either referenced or considered equity considerations or social and structural determinants of health considerations. We quickly found the work of Dr. Yasmin and her colleagues, and so we then shifted in the second phase of our project to reach out to her, but also to start to extend that formative work that they had done and had done so eloquently, and you'll hear about it. And then we're really in phase 3 right now, where we really want to consider the utility of the indicators and our equity prompts to support public health organizations and public health practitioners. So that's the phases of our project. The methods we used were that we reviewed the national and international level documents. It was really interesting even to go looking for them and to find them. And of course, the picture there is of what is affectionately called the Naylor Report post-SARS, Theresa Tam, wrote a review after H1N1 published in 2018, and we also found some documents, very recent documents developed by the World Health Organization as well as by the Government of Canada, and then also really had a strong focus on Yasmin's work and that of her colleagues, and she'll speak to that. So just really quickly what we found as we looked, and this is all in our document, and the document is you can find it online, and we'll pop a link in it in the chat box in a minute. So when we look back at the work of David Naylor, Dr. David Naylor and his colleagues when he wrote the report after SARS, is four main themes sort of came through in that particular document related to the social determinants of health and/or equity. First of all is that his recommendation or their recommendations was to maintain that ethical balance between the clinical needs of the people and the individuals, but also those broader needs of the population and in particular populations. That there was this real stark variation and differences in public health funding and capacity across jurisdictions across Canada that actually hampered or limited their capacity to respond, and this is to SARS. He talked about, or they talked about, a population health approach and really encouraged that social determinants of health needed to be considered in any public health approach or population health approach. And he also said, or they also said, that we needed to rectify the historical oppression and neglect of First Nations and Inuit communities. And it's interesting, Margaret and I had a chat last night, Métis population was not mentioned there, which I think really does indicate sort of that time and that historical context. 15 years later, or in 2018, Teresa Tam did a review, and these were sort of the two pieces that we found from that document that spoke to social determinants of health and equity. Again, highlighting these variations across jurisdictions, across public health systems in our country, and a strong encouragement to include First Nations, Inuit, and Métis people in all phases of planning, response, mitigation, and recovery in terms of emergency preparedness. What's interesting when we looked at the 2019 documents, both at the World Health Organization level and also at Canada, was that the vision was to ensure that every jurisdiction had the capacity. Again, that variation coming through, like what could support or be a foundation, and indicators can in some ways help to level a bit of that playing field as well. But their vision was to ensure that every jurisdiction had the capacity to reduce the risks and consequences of a health emergency. They also really looked at a whole of government approach, an upstream focus, again coming back to that population health perspective and to the social and structural determinants of health. And they also had a very strong call for community member engagement in every aspect, including the planning. In Canada, and this leads really well into Yasmin's work and her presentation, they called for a resilient 2030, so 10 years from now. And they really looked at resilience throughout their document, and the definition they had, or their perspective, was that resilience makes a huge contribution to strengthening social but also physical agency, and it increases at every level, including the organization, our ability to cope with, respond to, recover from, but also learn from emergencies. And this is a quote from that document, that resilient capacity is built through a process of empowering citizens, responders, organizations, communities, government, systems, and society to share the responsibility to keep hazards from becoming disasters. And so those were our findings from the review. So some things in there, some guidance, but during that process we were really happy to find the work of Yasmin Khan. So I'm going to turn it over to her now to speak to the research that they did and the findings, and then we'll come back to Margaret for the equity prompts to the indicator. So over to you, Yasmin.